Hi friends, this is Dr. GSS Mohapatra here. Today I am here to launch a series of gynecological video topics which were coming up in 4 different languages: English, Hindi, Oriya and Bengali. And being a senior gynecologist, laparoscopic surgeon, robotic surgeon and an infertility specialist who specializes more in endometriosis, my love for this disease is huge. I operate and treat this disease the most daily, on a daily basis, and it is very close to my heart, and so I thought that it will be the best way to launch this series, educational series for patients from this disease itself. So let's begin with this disease, which is called endometriosis, and how do the symptoms appear and what is the problem that the patients face and why do they face the problem. So let me clear this chart for you. As we all know, females have an organ called the uterus, right? So the uterus has an inner lining which is called the endometrium, right? Now the uterus has 2 openings on either side, which is called the fallopian tubes, and on either side the fallopian tubes are with an ovary. So 2 tubes, 2 ovaries and an uterus. The lower part of the uterus opens into the vagina. The intestine passes just behind the uterus, and in front of the uterus we have the urinary bladder where the urine is stored, right? So in the symptoms of endometriosis basically depend on the way in which the things are deposited in the body. So for example, what happens in a normal female? In a normal female, the blood is coming out of the uterus into the vagina and being shed every time during each periods during the cycles. But some amount of blood will go out into the muscular wall and gets deposited. It doesn't find a way out, and that we call it as adenomyosis. We will be discussing this for sure in some subsequent episode. Now some amount of blood enters into the tube, causing the tubes to be destroyed, and that is called hematosalpinx. Some amount of blood will get deposited into the ovaries, and that is called a chocolate cyst or an endometriotic cyst or an endometrioma. Some amount of bladder may go on to get deposited on the urinary bladder, that is called a bladder nodule, bladder endometriosis, and some amount of blood might get deposited onto the intestine and cause the intestine to be pulled towards the uterus, dragged and pulled towards the uterus, causing the intestine to be adherent to the posterior surface of the uterus. This is the posterior surface. Now this part between the uterus and this intestine is called the pouch of Douglas. This is one of the most common sites where endometriosis gets deposited, and we call it deep infiltrating endometriosis. Whenever the endometriosis enters the deeper layers of the female pelvis. So it is basically a disease of dysuria, difficulty in passing urine during menses. Dyschizia means the patient is having severe difficulty while passing stool during menses. Dysmenorrhea, this is severe pain, unbearable pain during menses, incapacitating her to do her daily activities. It has dyspareunia, means the patient has severe pain, deep pain while having intercourse, and it is again there is another D which is called dreaded endobelly. I mean to say the patient has a sense of severe bloating of the whole abdomen throughout the month. She always feels a sense of heaviness, constant fullness of the abdomen, which doesn't disappear on its own. So it is basically a disease of so many D's: dyspareunia, dysuria, dyschizia, dysmenorrhea. So today hopefully I have been able to communicate and make you explain the symptoms of endometriosis and why are they due to in a very simple and lucid manner. Hopefully you have liked it, and in the next episode we are going to come up with the how to diagnose endometriosis, and then further the treatment. Hopefully all of you have liked it. Time to sign off. Thank you. Bye bye.